Hello and welcome to UroChannel. Today's a very stormy day, it's autumn, it's raining and you don't want to be outside, but it's the perfect picture for what I'm about to tell you in this video. It's about testosterone deficiency in the aging male. And when we approach 50, the world sometimes can feel like a hostile environment, like it's stormy, nothing works out, work is just crap and family life is not working. And this might be due to testosterone deficiency. So stay tuned for this. I'm going to tell you all about the symptoms and treatment options. Hello everybody and welcome to UroChannel. My name is Stefan Buntrock, I'm a urologist. From a medical perspective, what separates men from women? It's testosterone. Already in fetal life, the brain of the male fetus is subjected to high levels of testosterone. This testosterone surge happens from week 8 until approximately week 15 in pregnancy. Testosterone is responsible for typically male behavior patterns and much more. In the aging male body, testosterone gradually decreases, as a rule of thumb by 1% per year from age 40. For most men, this is not a problem, but in some, testosterone levels drop much more, which is called late onset hypogonadism. This is also triggered by a sedentary lifestyle with associated increase in body weight and consecutively the metabolic syndrome with its characteristic mixture of high blood pressure, high blood sugar and diabetes, elevated cholesterol levels and gout. Obesity has become a serious health threat in the Western world. In the US, over 42% of the population were obese in 2017-18, according to the CDC, the Centers for Disease Control and Prevention. In Europe, Eurostat data indicate that more than half of the Europeans were overweight and 17% were obese in 2019. Why is increased body fat a problem for testosterone? Because fat does much more than just storing energy, especially fat that's located inside the abdomen. Fat is also hormonally active. It has the power to convert the male sex hormone testosterone into the female sex hormone estradiol. Additionally, also the testicles are subjected to the aging process, and as you might know, testosterone is produced predominantly in the testicles. Very often, a drop in LH levels can be observed in obese men. LH is the abbreviation for luteinizing hormone and is released from a small gland in the brain. LH tells the testicles to produce testosterone. With decreased LH levels, testosterone production will also suffer, and as you might expect, we are looking at a vicious circle here. Low testosterone will slow down the metabolism of the body, thus aggravating the unfavorable body composition. More fat means more cholesterol and fatty acids, which causes insulin levels to rise up to a certain point where it more or less becomes ineffective. Then diabetes will develop, and this in turn means an additional drop in testosterone levels for many. Obesity often results in sleep apnea, which confuses the day-night rhythm of the body, resulting in a disturbed releasing pattern of LH, which in turn results in low testosterone. Let's put the metabolic syndrome aside and concentrate on testosterone. The signs and symptoms of hypogonadism are decreased sexual desire, less morning erections, a ceasing rigidity with erections, diminishing beard growth, a decline in general well-being, excessive sweating without physical activity, joint and muscle pain, disturbances in sleep, depressive mood, a feeling that you're past your personal peak. Some of these symptoms overlap with other conditions, but if you experience a bunch of these symptoms, it might be a good idea to get your testosterone checked, because testosterone is important for much more than just sex drive and erections. Your bone metabolism depends very much on it, and low testosterone increases your risk for osteoporosis and cardiovascular disease. There is also evidence supporting the elevated risk of prostate cancer with hypogonadism, and it is important for mood and overall vitality. A diagnosis is made by measuring a couple of parameters in the blood in the morning, preferably before 11 a.m. I always combine testosterone with the sexual hormone binding globulin, SHBG, to calculate free testosterone, LH, estradiol, prolactin, and TSH. The latter two are important to rule out any thyroid disorders and benign enlargement of the hypophysis, which is a small gland in the brain. Hypogonadism is treated by administration of testosterone. This is done either by a gel in the morning or injections every 3 months. Personally, I prefer the gel since it mimics the natural release of testosterone more closely than a depot injection. There's one more thing to rule out before treatment begins. It's prostate cancer. Because prostate cancer cells feed off testosterone, it would be detrimental to nourish them by giving testosterone. Now, I want to make one thing very clear. There is no scientific evidence that testosterone causes prostate cancer. But if there was an already existing prostate cancer, prescribing testosterone would be harmful. The goal with testosterone replacement is to raise levels up into the normal range. Slightly above 12 nanomole per liter would be okay. Please keep in mind testosterone replacement therapy takes time for results. Psychological effects can be expected after 3 weeks, but body composition is long-term. The maximum effect on bone metabolism is reached after 3 years. When testosterone replacement therapy is administered, the metabolism will go at a faster rate, meaning that a moderate weight loss towards a more favorable body composition with less fat and more muscle will be the result. If you think you might be suffering from hypogonadism, look for the aging male rating scale on the internet and do the test. If it's positive, go see your doctor. Thanks for watching. Bye bye.